We're back here with Janine because her story, not only is it quite an eye-opener in terms of finding a lump and making a diagnosis, but it was years later where you got another surprise. Tell us about it.
Well, the surprise of being pregnant.
That was a surprise.
That was a great surprise.
That's a great surprise.
It was.
But this was not the one I'm thinking of.
No, I know. But after I had my daughter, my oncologist said, okay, now let's look and decide on what we do with your ovaries. So let's start the genetic testing. Genetic testing was coming around then, being very big.
It was very new at that time, too. We didn't have it when you and I were, we didn't even know about it, but it's...
Yeah, no, it was coming along. So let's test, and he said, let's test you for BRCA1 and 2, which are the primary genes for that to decide if we're going to remove your ovaries. So I said, okay. So I went in for the testing, and then they called me back in to sit down with the genetic counselor and the oncologist to go over the results. So the results were negative. So I asked, my mind is always curious. I don't know if that's the lawyer in me or what. But so I said, what else is connected? Is there anything else connected to cancer? So they kind of jokingly said, yes, there's one that's connected with head size, thyroid nodules, uterine fibroids, and a skin condition. So I raised my hand and said, I have all of those. The hypochondriac.
You did have all of those.
I did have all of those.
You were serious.
I was dead serious.
They must have fallen off the chair.
They were laughing because the skin condition associated with it is usually much larger than I had, but I showed them a couple of the bumps. They measured my head, and I mean, there was no secret that I had.
Who would know looking at you? I've known you all these years. When I heard you had this Cowden syndrome with the big, I said, she's normal. How do you know you had a big head? How did you know that?
Hats never fit. Very simple.
And you never forgot it.
No,
did it ever occur to you that must be something a little weird about that, or did it just?
I took the compliment. People said more brains, so I said, okay. I'll take that.
That's great.
So when they measured it, they said, wow, yeah, you're in the upper 95 percentile. So they took my information down. She said, well, we'll see. I got it. At the time, the study was under the Cleveland Clinic. So I think it was either a few weeks or a few months later, I was at the oncologist's office, and there's the genetic counselor sitting there. I said, what are you here for? That, and kind of jokingly, that head and thyroid thing. And she said, yes, they want to test you.
They want to test the thyroid, or they want?
They want to test me for that gene.
The gene. So just so this is an unusual. Janine's a silent carrier for a mutation called PTEN. I had never heard of it before. You're the first case I ever heard of. In fact, it's just recently where we're routinely now screening for PTEN, but. Who would have known? I mean, you don't have an obvious thyroid nodule, and nobody knows looking at you, and the skin condition's so subtle. So how did that conversation go?
Yeah, it was, I sort of laughed it off, but I mean, I fit the parameters, and I said, sure. I mean, it's, here I've been several years out, and I mean, I had it young, and everybody said young is rare, and we've all learned through that young is not rare. So they tested for the PTEN mutation, and sure enough, shock to all of us, I came back positive for that mutation.
Yeah. So you're what we would call a silent carrier. And there's silent carriers for all these new mutations. Yeah. The BRCA1 and BRCA2 we're all getting pretty familiar with, and those are the most common. But now we screen for 23 other genes, and I'm sure in 5 years from now it'll be 50 or 100. We'll ultimately learn all the mutations that are related to cancer risk, but this is not only related to breast cancer, but tell us about other risk factors.
It is, I'm so grateful for that, because once you get diagnosed with a genetic mutation, they change the screening based on what you're at higher risk for. The risk associated with PTEN is 80% for breast cancer. But it is
by 80%, you mean a woman who carries the gene has an 80% lifetime risk of developing breast cancer. I think that's right. Yeah.
Which is frighteningly huge, but also it increased the screening for kidney, thyroid, uterine, and colon. So the screening protocol for that changed and saved my life, because because of that screening protocol, I've had my thyroid removed because of suspicious stuff on an ultrasound of the thyroid, and the pathology showed precancer there. I ended up, because of the screening, having to have my ovaries and uterus removed. I now have to have annual colonoscopies, because with Cowden syndrome, you technically grow things, and I annually have around 9 to 10 polyps.
Is that right?
Yes.
So this is on the verge of considering subtotal colectomy, or are they just going to follow you really carefully?
They just follow. I go there every year, and it is with the genetic. I am under the care of a fabulous genetic team at a university for that screening protocol. And it's just amazing. It's how far it's come, and it's saved my life so many times over. It's not even funny.
You're more of a cat, aren't you? I mean, the cat woman, 9 lives. It's just unbelievable.
I'll knock on wood with that one.
But it makes a really important point. I mean, everybody's kind of familiar with the BRCA1 and 2, and there's just a lot more to it. So the issue of silent carriers, right now we're just starting to think about what we do. But for instance, your Ashkenazi Jewish background, Mary Claire King, who was the founder of the BRCA1 mutation, has gone to Israel, did studies, and found a very high percentage of silent carriers. By identifying the BRCA carrier before they develop cancer, you can either screen them more aggressively with MRI, or in some patients offer prophylactic mastectomy. But what Dr. King is now talking about, she received a major award and worldwide recognition very recently, and she brings up the issue of preventable deaths with cancer or a failure of prevention. That she sees that when a woman is diagnosed with breast cancer and she then found to have a BRCA mutation, you've missed the boat. You really want to catch it when she's 25 or 30. Then you do the aggressive screening. She has her children more at a younger age, and then starts considering prophylactic mastectomy or very, very careful follow-up. So this whole world of genetic testing is expanding so rapidly. I mean, you're the example of probably one of the more complex cases I've seen, but there's so much more going on than we had ever realized. The cost is also another big issue. It was $4,000, at least when Angelina Jolie a couple of years ago was undergoing this testing. But now you can go on the web without a doctor's referral. You can sign up for a test where they'll measure all the genes. It's $249. This is done by Color Genomics, and it's a real breakthrough, because it wasn't but a year ago that anybody who was at risk, we would send them to a genetic counselor. Well, the counselors can only see so many patients, so they only look for the very high-risk women. But here you would never have qualified for that had you not had the cancer, and yet you were carrying that mutation from birth. So quite a story.
Yeah, my big mouth has saved my life.
I think, and you make the point that you're proactive about these things. You take them serious. You don't miss a beat. You demand that people give you answers, and I think you're right. I think that did save your life, and I think that that's a fantastic message when you have to be in control of the situation. If you have a problem, particularly with the breast, you go through your list of questions. You make sure you get the answers. If you don't have a feeling of confidence, then seek more attention. Get that second opinion. A second opinion saved your life, and a second opinion could save your life. It's a really, really important rule to remember, that you be proactive and be in charge of your breast health.